really and truthfully, there are things we wish we understood beforehand. For me, as a young woman, I was diagnosed at 30 years old. These aren't conversations that we were having at my age.
Breast cancer impacts tens of thousands of Canadians each year, and each one of those experiences differs from the other. Now, a collective of healthcare professionals and advocates is coming together to highlight the experiences of Black women in a national event that's meant to educate and empower.
We're talking about a life and death disease, right? And so, the what could possibly happen are things that we don't want to imagine.
The Olive Branch of Hope sees firsthand how supports offered to individuals and families can change the experiences of those diagnosed with breast cancer.
We just need you to know that you have somewhere safe. There's a big gap between who's in the system and who's out of the system. And so if you're in, it's great.
The Toronto-based group says there are those who struggle to find supports, even in a country like Canada, where you can be systemically left out of receiving the care needed.
Access is free, but it's not equal.
If we want to provide everybody with the best quality of care that we can, we need to recognize that one size doesn't fit all.
On the 17th day of Black History Month, the organization is set to join Toronto's Women's College Hospital and others in hosting Breast Health for Black Women, a free event that will provide educational and community resources, increase knowledge and awareness.
We heard just so many stories about women experiencing these challenges, feeling excluded when they're already on this difficult journey, that we wanted to do something to increase knowledge, empower, and just bring a community together.
The hope is that more Canadians learn more about breast cancer, risk factors and prevention, screening, early detection in a safe and supportive space. And this is just a start.
We don't do enough health research in Canada on racialized people, including Black communities. So I think that this can be a starting ground for us to really start to understand from a research perspective, what is a Black experience when it comes to breast cancer and other cancers? What do we need to do here, and doing that in an evidence-based manner?
And through this conversation, highlighting the importance of understanding your body, your history, and your family tree.
It's important for women who look like us and sound like us, who understand our backgrounds and where we've come from, to be able to know it's okay. It's okay to talk about it. In fact, we actually have to talk about it.
Now, if you are looking to attend this free event, you are asked to register for the Breast Health for Black Women on Eventbrite. That will take place on February 17th. Afterwards, the organizers say they're also hoping to set up a website where they can add resources and supports. In Toronto, I'm Faiza Amin for City News.